So this lecture covers nucleated reds, and nucleated reds, again, are metarubricites. And as I mentioned in the erythropoiesis lecture, metarubricites or nucleated reds are one level prior to the reticulocyte, which then becomes the mature erythrocyte. And by definition, these guys have a nucleus, nucleated red blood cells, and so they're not normally released into circulation except in states of marked regeneration where they kind of might hitchhike along and you might see a few. These earlier erythroid progenitors you almost never expect. They're also called nucleated red cells, but you don't expect those earlier forms. And this picture on the left is actually a bone marrow with erythroid hyperplasia. And all of these cells I'm circling are metarubricites that are more mature. And then these guys in here are the less mature red cell progenitors. And there are different stages of rubricites, and even a rubroblast is in there as well. So when we have metarubricites in blood that are increased in number, and normal numbers are a 0 to 1 nucleated red blood cells per 100 white blood cells. I'll tell you in a second how that's counted. But when you have increased numbers, that is called a metarubricitosis. And so instruments, when they evaluate and count metarubricites, it really depends on the type of instrument and how it evaluates them. And we have instruments that are impedance, and then we have instruments that are optical. And our instruments are actually a lot fancier than this now, but I'm going to just say this a little bit for simplification. So impedance analyzers are, I always describe it as like a big eyeball that really can't see all that well. It recognizes all these cells that have nuclei, but it can't tell them apart. And so an impedance analyzer would count all of these metarubricites, whereas an optical analyzer is like an eyeball with a really great pair of glasses on and can tell the difference between white cells with nuclei versus these nucleated red blood cells. So that means that you actually have to do a manual count to tell the numbers of metarubricites that are present. And so we usually do this and we count the number per 100 white blood cells. And if it's greater than, oops, that did not work. If it's greater than 5 and we know that we have an impedance analyzer, then we will we'll correct the white cell count, and we'll talk about that when we're in the white cell section. So metarubricite numbers, nucleated red cell numbers, can be an appropriate response when seen with regeneration, or they can be inappropriate. So we see appropriate and inappropriate metarubricitosis, and I'm going to talk about that next. So one thing that's really important to realize is that the presence of metarubricites does not equal regeneration. So if you see these in circulation, they're increased, that is not a regenerative anemia, but they can accompany regeneration. So if they accompany regeneration, so these guys, remember, these are all our polychromatophilic red cells, and there's a lot of these compared to this one nucleated red blood cell. So that's appropriate when they accompany that. So there's many things that cause an inappropriate metarubricitosis, although admittedly it's not super common. And so I'm going to kind of go through a few of those, and remember, these aren't super common, so this is not something I'm going to emphasize in the class, but I want you to be aware. So bone marrow injury due to several things, so heat stroke, can damage this very delicate barrier between the marrow spaces and the blood. So heat stroke, hyperthermia, lead poisoning. Actually, this is a case in the picture of lead poisoning. There's increases in nucleated red cells and all these little stippled things in the red cell. That's called basophilic stippling. It's a poor picture. So lead poisoning, infiltration of bone marrow with neoplasia or infection. So bone marrow diseases, Bone fractures, weirdly enough. So if there's a severe fracture, you can have release of some marrow particles, and nucleated reds can be seen in circulation. And then splenic disease, recent splenectomy, because the spleen removes nucleated red blood cells. A very specific subset of nucleated red blood cells that are increased, where you'll see very immature, are erythroid leukemias, but that's exceedingly uncommon. We mostly see it in cats.